Hey, y'all. You're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason on News Radio 1510 WLAC. I'm Dr. Elizabeth Baker.
And I'm Dr. Jason Reinarts.
And we both run successful practices in Brentwood and Franklin. We're both chiropractors. And I think I threw Dr. Jason off by saying, hey, y'all, when we first started.
I want to try that. Hey, y'all. Do I sound southern?
It doesn't sound too natural for you.
No, it just doesn't come out right.
I know, but we're your local health and wellness experts, and obviously one of us is a local, and Dr. Jason is from not local.
That other, I would
the
say the
left coast.
The left coast. I was going to say that other coast, but there's not really a coast in Nashville. So
I guess we got the coast of Percy Priest Lake.
That's true. That's true.
Coast of Cumberland River.
There you go.
You don't want to go get in there, though. Anyways, well, if you've never listened to our show before and you're just tuning in for the first time, we are both chiropractors, and we discuss different health-related topics and how chiropractors can help those sorts of symptoms, issues, and other things. And we go into some other tips and handy suggestions that you could do as well.
Yeah. What we really are nervous system doctors, and that's one of the things that I get questioned a lot. I get a lot of medical doctor friends and other people, and they say, how can you guys say that you treat this? How can you say you treat that? And we don't say that we treat that. What we're experts at is removing interference to your nervous system, which controls every aspect and every function of your body so that your body can perform better, adapt to the environment better, and give you better health.
And in turn, what we're known for is treating neck pain and back pain. That's kind of the basic of what people know chiropractors are good at. But the reason we're good at that is because our bodies have a natural ability to heal themselves. We were designed to be self-healing. That's how humans have survived for as long as we have. And whichever route you look at it as, we've been around on the earth for a really long time. And that's not because of dumb luck or because of modern medicine. Because if you think about what modern medicine was 2,000 years ago, some of it was pretty stupid.
And that's kind of what's really neat about chiropractic, too. If you look at the history of chiropractic, very little has changed in the entire history of chiropractic.
Well, and even that, it goes back further than the first inception of what we call chiropractic today. Oh, yeah. Even Hippocrates, the father of modern medicine. I mean, that was something BC. That was quite a while ago on the calendar. But even he himself used physical medicine, as we do, to treat some of the same symptoms and same things that we use still to treat. He looked to the body to make the body heal itself, but make sure it was working like it was supposed to heal itself. And he's the guy that, what is it, the Hippocratic Oath that all of us in medical school have to take and hopefully ethically can abide by. What is it? Do no harm and whatever.
I never took that oath. So
no, I don't think they made us do it because they just figured we were doing the right thing already, I guess. Yeah. But something about do no harm and, look to heal the body and that sort of thing. So
that's one of the reasons I love being a chiropractor is the body is amazing. There's an intelligence inside the body, and it wants to be healthy. I tell my patients when they say, Dr. Jason, is there a chance for me to heal? And I say, absolutely yes. Your body wants to be healthy. An example of that is if you cut yourself right now, you're not just going to bleed out and die. Your body's
some people might.
Well, some people might. That's true.
There's some clotting issues there.
That's some true. But if you don't have those issues, you're going to clot and you're going to heal. And if you leave that scab alone, it's never going to look like you were cut in the first place. The body wants to move towards health. Sometimes it just has problems, and that's where we come in.
Yeah. Now, if you're not one of those bleeder people, the point of what Dr. Jason was saying is that you don't have to think about your body healing. There's something innately inside every one of us that goes towards self-healing. It goes towards survival, and it goes towards life and healing. It never actually wants you to die, but what we have to do is make sure that things are working like they're supposed to so that we can get towards that healing and towards that living.
Yeah, there's an amazing intelligence, for your heart to beat, your lungs to breathe, for you even to go and eat a junky meal and your body can still pull out some nutrients from it and use that, to survive. It's amazing. And you don't consciously think about any of those things going on. There's an intelligence inside of you that controls all that.
And even more to what you just said, the junky meal. Yeah, there's going to be some chemical toxins in that junky meal too. Maybe there's preservatives or color additives or artificial sweeteners. I mean, all these things are actually toxic to the body, and our body can differentiate what those toxins are, and it's able to filter them out. Now, sometimes we test it a little too much. We poke the bear a little long, and it can't filter those things out anymore. And that's when we start to do damage to ourselves because of things that we're doing to ourselves that we weren't meant to be doing to ourselves.
Yeah, and Dr. Liz is right. It's fun in my office, and I'm sure it's the same in her office, because people generally don't come in my office saying, hey, Dr. Jason, I'm here to express my full health potential.
No, nobody. Well, once in a blue moon.
Very rare.
Once in a blue moon, somebody's done their research.
It's mostly I have headaches, I have neck pain, I have back pain, I have sciatica, I have things like that. And
they're coming to us with a problem.
Yep. And what's fun is along their course of treatment, as whatever they're coming in for is improving, it's fun when you get to a certain point and then they start saying things like, hey, doc, I don't know if this has anything to do with it, but I'm sleeping better. Or my acid reflux isn't what it used to be. Mm-hmm. Or I didn't tell you that, I have one bowel movement a week and now I'm having one a day.
Yeah. Those are pretty common ones, actually.
Yeah, and we hear these things all the time. And what's amazing about it, as you remove interference to the nervous system, which controls every aspect of your life, your body is going to improve, and the intelligence in the body is going to say, now we're able to get back to doing things normally as they're supposed to.
Mm-hmm. Now, if you're tuning in for the first time, each week we actually offer an opportunity for you to come in and talk to either Dr. Jason or myself. We offer for 20 callers each week an appointment with one of us. That includes a consultation, an exam, and something we take called a motion study x-ray. Only about 700 doctors in the world know how to do this particular test, but what it shows us is what's working and what's not working. So you could be coming to us for headaches, neck pain, or low back pain, but we may be able to see from that test what other symptoms that you could have that are coming from a spinal misalignment. That test is normally $250, but today and this week, it's $20 for the next 20 callers. So give us a call at 615-727-3107. Give us a call and get on our appointments for this week.
Yeah, and it's been fun meeting the callers that have called in, and I can't urge people enough. Call the number, get in, because just about everyone that is coming to my office, maybe yours too, Dr. Liz, they've waited for so long to get their health back. Don't wait any longer.
Yeah, or like we talked about last week, maybe you've been having this problem for years and it comes and goes, and maybe you've been treating it symptomatically. It's time to get those problems fixed so that they don't cause you further damage, further problems in the future. Because
the biggest lie is if I do nothing about it, it's going to stay the same. Biggest lie.
Or I let it get better on its own.
Yeah. It's not going to happen. You're either getting better or you're getting worse. And if you're absolutely doing nothing about it, you're getting worse.
Right. So now's the time to start taking care of your health. Give us a call, 615-727-3107. You're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason, and we'll be right back.
Hello and welcome back. You're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason here on News Radio 1510 WLAC.
Hey, how are you? So before the break, I thought Jason was going to say a little more than that. So
I was going to, but...
Oh. Anyways, but before the break, we were just talking about some of our patients come in and they talk about other symptoms that have gotten better while they're under our care for something else. They may be in for low back pain or in our office for neck pain, and they start noticing other symptoms start improving. So what we wanted to go over today is, some of those side symptoms that could be caused by nerve interference.
I got a great one. And this even goes outside of what we're talking about right now. I had a lady come in, and the reason that she came in is because she was developing the hump in her back that she had grown up seeing in her grandmother and was terrified. She's like, I do not want that nursing home posture. She's like, I will do whatever it takes, but I'm starting to see it. And she was showing me, she's like, look, see, I'm starting. And she was right. She had bad forward head carry. Her upper back was rounding. And she said, I don't look right. I hate it. I don't even want to look at myself in the mirror. You got to help me.
Yeah. And what people don't realize is poor posture has, over many studies and over many years and lots of research, poor posture is linked to a lot of internal organ damage, lung, heart. These things can't work properly if your rib cage is collapsing down. So it's not just a visual vanity aspect of it, but it's actually an internal problem too. Well,
and that's why if you look at rods being put in, it's usually young girls' spines to straighten them out, is because medicine knows that scoliosis left uncorrected is going to wreak havoc
On the organs.
On the organs, and it's going to cause them to shut down and malfunction prematurely.
Yeah, and what he's talking about is something called scoliosis, like an S-shaped curve to the spine. And what his patient was concerned more about is more like the Hunchback of Notre Dame. So either one can be unsightly from the outside, but both can cause dysfunction on the inside as well.
Yeah. And it's interesting because most people who come in aren't thinking about their internal function. And that's one of the biggest challenges. In this country, we're taught to believe that how you feel equals how healthy you are.
Which is so far from the truth. And part of that is human survival. If we had an ailment or a symptom or a pain every time something was wrong, I don't think humans would have survived as long as we have. Only 10% of our body or 10% of our nervous system controls actual symptoms, whether you feel pain or not. So listening to only 10% of what's going on is a bad idea.
And what's crazy is symptoms show up at about 60% function. So you've lost 40% function before you start to feel it. So by the time the symptom shows up, you're not at the beginning of the problem, you're in the middle of it.
Mm-hmm. And also before the break and in previous shows, if you've listened to us before, we've mentioned that there are different types of chiropractic care as well. Different types that aim at correcting symptoms, and then they send you on your way and say, call us back when you hurt again, versus what Dr. Jason and I do, whereas we correct the problem and we try to find the underlying cause of the problem and try to get that as corrected as possible. So it's more of a long-term solution. And I get patients, I mean, I'm sure you do too, all the time that say, well, I've been under chiropractic care for years, or I used to be under care and I would go and Dr. Flibbity Gibbet would do whatever he would do and I'd feel great and I wouldn't have to go back for a couple of months, or maybe I'd only go a couple times a year. That's not necessarily the best way to go about it. And if we can get the little clip pulled up here, we have a couple of testimonies that we've gotten from other patients in our office. And this one's actually a patient in my office. And this testimony is actually from about 6 months ago, and she's actually still under care and saw her. That was the last patient I saw yesterday. But what I want to have it flip on here for is just because she's going to tell you in her own words that she's been to other chiropractors before and that we actually do things differently.
Hi there, I'm Heather, and I am a patient of Dr. Liz for about a month now, and I just wanted to say how amazing this office is. I've been going to chiropractors off and on for quite a number of years due to car accidents and sports injuries, and this is the first time that a doctor has really gone in depth and telling me what my injuries have done to my body and how we're able to fix them. And after a month, I am so pleased that I don't have neck pain anymore, and we're still working on my back, but I know it's going to be better soon. So I highly recommend Dr. Liz and her team.
And that's like I said, that's a patient that's been coming for almost a year now since we actually filmed that. So if you are curious to know if you've got something we can help you with, if Dr. Jason or myself could help you, give us a call at 615-727-3107. We offer every week 20 spots, and we've only got 17 left for this week, but we've got 17 spots left for a consultation, an exam, and special motion study x-rays where we can see what's truly going wrong with you. 615-727-3107.
Yeah, give us a call. We'd love to get you in and see basically what your potential is. Not only that, but who wants to live in pain? I know I absolutely don't.
I don't. Who wants to live in pain? Some other symptoms that we see improve. Dr. Jason was mentioning, maybe bowel movement frequency. I know nobody likes to talk about poo, but it's a real thing. I
cannot believe the number of constipated people in my office every week where and this usually doesn't come up on the initial exam.
No, it never does unless you ask.
But as you get to know the person, because that's what's really neat about coming into a chiropractor too, is because we see you more frequently than just say your typical medical doctor. We get to know you really, really well. And
I love that part.
Yeah, I do too. The relationship that develops, and then you get to, as you gain rapport and that person gets to know you, they let you into their world more. Mm-hmm. And when I hear that someone's having one bowel movement a week,
ugh.
Can you imagine the toxicity? That's your body's, other than through your skin, your body's main way of detoxification. Mm-hmm. You're just keeping all that inside of you. There's no way you can be healthy being like that.
No, you can't. And another thing is, the other side of that is the frequency, urgency, or constantly always needing to go urinate. That's another symptom that we see can also improve. A lot of times people will tell me, hey, Dr. Liz, I used to get up 5, 6, 7 times a night to go pee. I didn't realize that wasn't normal until about 2 or 3 days ago. I realized I slept through the entire night and didn't wake up until my alarm went off. My bladder was not my alarm all night. It was actually my alarm.
And we're good at finding these things out, too, because where the nerves go, those pathways are all known. So when someone comes into either myself or Dr. Liz and they have low back pain, our minds are already going, do you have these other things? Do you have constipation? Do you have hormonal issues? Because we know that those nerves are what you're feeling with. We know where the muscles that they go to, and then also the organ systems that they go to.
Mm-hmm. You got different types of nerves, some of them that are responding to feeling, pain, pressure, hot, cold, those sort of things. Those are what we're more familiar with. But then you've got all those automatic nerves that just do the stuff that they were designed to do, and they do it without you thinking about it. We also know the map of, or the kind of the roadways of where the nerves actually go in the body. And this is basic, neuroanatomy 101, just where do the nerves actually go to and come from. And so a lot of times during that exam, that initial exam, we actually start feeling the spine, and we might find high spots, tight spots, sore spots. And in those same areas, we know the questions to ask. Hey, are you having issues with heartburn? Because we're hitting that same nerve that also creates heartburn. Well, you know what, Dr. Liz, I forgot to tell you, I take Nexium every day, or Tums. I eat Tums like they're candy.
Yep.
And we're not surprised anymore at this point, but it's always amazing to our patients that we're basically telling them what's wrong with them without them telling us themselves.
And then when we take those motion study x-rays to further put it all together, and we can see the dysfunction of the movement of those individual vertebrae, and we know the nerves that are exiting from them, we can put the whole picture together and say, this is what's going on, this is why, and this is what we can do to help.
Mm-hmm. And if you're one of those people that's looking for help, give us a call, 615-727-3107. Dr. Jason and myself both have some spots available in our schedule to get you in. We'll do a consultation and an exam where we might find out some things that you didn't even tell us. That number again is 615-727-3107. We'll also take those special x-rays that Dr. Jason was about to mention, but that test is normally $250, but for this week, it's only $20. So give us a call.
And when we get back, if we have time, I'm hoping we do, I want to talk about my patients that come in because they're trying to get pregnant. I love those ones.
You don't want to go running around town telling people your chiropractor got you pregnant. You can get in a little trouble, but it's true. There have been patients in my office that were struggling with infertility, and they pretty much all but gave up, and they have 2 kids now.
Let's talk about that when we get back.
We will. So if you're just tuning in, we'll be right back. But you're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason. We're your local health and wellness experts, and we'll be back after these few messages to give you some tips on how we actually help with infertility. Hey, y'all. I'm doing a little dance here in the studio, but
hey, I was dancing too.
You're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason. If you were just hopping on here with us, we were just talking about all the other symptoms that we can help alleviate besides just neck pain, back pain, headaches, the things that we're commonly known for treating. And what Dr. Jason was giving us a little teaser before the break is how he's getting his patients pregnant.
Yeah. Well, hey.
I don't want to get you in trouble, but
I once saw a bumper sticker that said, "My chiropractor got me pregnant." I almost bought it for my car, but then I'm like, I don't know how that's going to fly, so I passed on that one. But
yeah. But what we actually mean.
Yeah, and what we're talking about here is, and the beauty of what we do is we're not saying we treat any particular symptom. That's not what we're about. We're about
not treating infertility.
Correct. We're about underlying causes. We know the nerves that go to the reproductive organs. We know if we remove interference from them, that they work better.
They function better. They work better.
And if you come in to see us, you're having these kind of problems, we look at what's going on with you, we take detailed motion x-rays, we see that nerve is being greatly impaired. Let's just say it's working at 50%. What does it look like when we get it working at 80, 90, close to 100%? You've got to be doing better. And that's where we get results, is because we're removing interference to allow the body to do what it's supposed to do.
Mm-hmm. And when your brain can communicate with your body parts and vice versa, when your body parts can communicate to your brain, things are just able to function better. They're able to respond quickly. They're able to respond correctly. It's kind of like if you imagine that game you used to play as a kid called telephone.
Yep.
You pass the message around the circle, and you're only allowed to say it once. And if you don't hear it right, you just repeat the best thing you think that person told you. And by the time it gets back around to you, a lot of times it's scrambled. It's totally different, and it may not even sound anything close to the original message. But let's say it's nice and quiet and everybody speaks clearly, and that message gets all the way back around, and it wasn't near as funny, but that was, kind of the difference in a functioning nerve and a poorly functioning nerve. The message still gets through. It just might be garbled.
And the body right now is doing the best that it can for the circumstances that it's under, but the best that it can is no baby.
Right. And in that aspect, it's trying to fill in the holes for the messages that are getting messed up. So it might be hearing every third word, and it's just assuming what those in-between words are, and it's making up its own course of action for how to respond. So we're trying to make sure that all those messages get through clear, loud and clear, and your brain and your body can communicate properly.
Yeah, I've had a number of people come in to see me over the years for infertility. And, and again, not everyone who comes in, all of a sudden, it's not like an adjustment equals pregnancy.
No, not every time.
But with a number of them we worked with over time, they have gotten pregnant. And the funny thing is they say, oh, Dr. Jason, we can't help you enough. This is amazing. And then they say, if we can do anything for you. And I'm like, well, if you're having a boy, Jason's a great name. But yet I still have not had one named Jason.
No, not yet. Well, one day somebody will pick it up.
I think Jason's a good name. Is it not a good name anymore?
It's a good, strong name.
That's what I think.
Jason and the Argonauts, wasn't he like a...
Yeah.
Or if it's a girl, Jacina.
Jacina.
Jacina, if it's a girl.
Our producer chimed in. Jacina for a girl.
You need to suggest that, and that'll up your chances 50%.
There you go.
Jacina's.
There you go. Makes a guy and a girl name. Now, I don't know how Elizabeth works so well for a boy's name, but maybe Elliot or something is close.
Yeah. Yeah, there you go.
Anyway, but what we were just talking about is something called a subluxation. That's the medical term of your body not being able to communicate with your brain or your brain with your body properly. That's called a subluxation. It's similar to the most people are familiar with are dislocations, where two joints physically come apart. That's not exactly what we're talking about. We're talking about just a little bit. They're out of alignment. They're not in the right motion, and those bones could be putting pressure on those soft nerves in your spine, and it creates those messages to get mixed.
Yep, and I've seen studies that say the weight of a dime can cut off nerve transmission by 60 to 70%. The weight of a dime.
Mm-hmm. And I think it said that weight of a dime just for an hour is all it takes for it to start decreasing the function. And there was a study back in, 1987, that was in the Clinical Biomechanics Journal. And it said when immobilization, or what we're talking about, subluxation, occurs in a joint and it remains there for more than 10 days, that joint actually begins to degenerate. You actually start to form arthritic changes within just 10 days of a joint getting stuck.
I always say if people wore their spines on their face, they would take immaculate care of their spines. And again, the challenge is you don't feel your spine. You don't see what kind of degenerative changes are occurring till a lot of times it's too late. And that's one of the saddest things when somebody comes in to see me and their spine is so degenerated. I'm thinking in my head, like, where were you 20 years ago?
And they might not have been feeling great, but they didn't feel as bad as they did by the time they got to you.
Yeah, health's your most important asset. If you don't have your health, I don't care how much money you have, fame, notoriety, whatever it might be, you got nothing.
Yeah. Another thing that we are talking about today is increasing your immune system's function. Your immune system actually works better when your spine works better and your nerves are free of interference.
Yep, and they say, what is it? I think it's 90% of your brain's nutrition and basically exercise to your brain comes through spinal motion.
Yes, it does. Your spine has something around it called spinal fluid, which you've probably heard about, and it's similar to like blood flowing through your arteries and veins, except it's its own closed system, and it flows around the brain and around your spinal cord. And movement is what pumps that fluid up and down and in and around your brain and spinal cord. Much like your heart is what pumps your blood, movement is what pumps that fluid.
Yeah. So, Dr. Liz, if somebody wants to come in, whether it's, for the traditional thing that we see most people, neck pain, headaches, back pain, but other things too. We've talked about infertility. We've talked about heartburn, posture. We've talked about all kinds of things that bring people into our office. Let them know how they can do that.
Yeah, you can give us a call, 615-727-3107, and that includes a consultation, exam, and if we need to take those motion study x-rays, it includes that as well. Normally that test is $250, and for the first 20 callers, and I think we've only got 13 spots left for the week now, but for the next 13 callers, this offer will only be $20. So give us a call.
Yeah, one of these days I'm going to actually say that offer, but I always ask you to do it because, man, you do it so well.
Because you never let me say the number. 615
say the number, Dr. Liz.
727-3107.
Awesome. And if you just tuned in and you're saying, who are these two? We are a guide to healthy living with Dr. Liz and Dr. Jason here on News Radio 1510 WLAC.
We're your local health and wellness experts. We're both chiropractors. My office is in Brentwood, and he's down in Franklin.
Yeah, just a little bit south. And she's from Nashville, as you can tell by her y'all. I tried to throw out a y'all, but it just fails miserably.
Sounds fake.
It is fake. I still haven't gotten it.
Faker.
I know.
But back to the immune system. There was actually a study and a new discovery that happened within the last year and a half. They actually have found a new body part that proves the link between the immune system and the brain. They're actually going to have to rewrite the medical textbooks to include this tiny little body part that proves that there is actually a link between your brain and your immune system.
Yeah, it's awesome. Things that we've been talking about for a long, long, long time, and it's fun. Well, it's fun, and it's exciting that science is catching up with what we see every day in our office.
Exactly. And what we're looking at when we look at those sorts of things is that it basically clinically and scientifically proves what chiropractors have known to work for the last 60 years since chiropractic has kind of been around.
Yep.
We have known for not really able to explain exactly how, but we just see these changes anecdotally in our office for the last century and a half. We weren't really sure exactly how, but now there's proof that what we've been talking about, we're not crazy.
And, furthermore, with the immunity that you were talking about, I am seeing so many people now with allergies, sinus problems. Chiropractic is wonderful for that, too. And, again, that goes along with an immune response going on. And, if you're someone out there with allergies and sinus problems, especially this time of year, you're not alone. There's a ton of people coming in to see us for those reasons right now.
And if you're one of those people, give us a call, 615-727-3107. Get in to see Dr. Jason down in Franklin or get in to see me up in Brentwood. Give us a call, 615-727-3107. Let's get on our schedule for the week, and we'll give you a consultation, exam, and those special motion study x-rays that we always talk about. Get in and get your immune system checked. Get in and let's check out why you keep having headaches all the time. You might take ibuprofen and it goes away, but it comes right back. Let's see why that's happening. So give us a call. As always, you're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason here on News Radio 1510. And when we get back, we're going to talk about kids again. We're going to talk about kids' immune systems and how we actually help those guys.
I love talking about kids, so I'm excited about this next topic.
So when we get back, stay tuned and we'll talk about that. See you back in a minute.
Welcome back. You're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason here on News Radio 1510 WLAC. And right before we got off there, Dr. Liz was saying that we're going to talk about one of my favorite topics, kids.
Kids, the little ones, the little wee ones, little buddies.
Talking about kids. My office is full of kids.
Yeah, earlier this week, probably over the 4 days that I was open, I want to say I probably had 30 kids over the week. I think maybe because it was spring break and everybody had more availability to come in, but it was awesome. A little chaotic at times because you get 6 or 7 kids in there that don't know each other and they start playing, but it's awesome.
It is fun chaos because I go out to my front area after kids and it's like a little whirlwind, but it's great. I love the energy. I love seeing their faces and, oh man, they love chiropractic. They do.
They respond so well. And just like big kids, adults, little kids have some of the same symptoms. Little babies have things like heartburn or acid reflux or GERD, whatever you want to call it, just like adults do. And the same way that we treat adults, we can also do for kids.
Yeah, and they're just so sweet. I had, it was about 2 weeks ago, a little guy in, and his mom she wanted to talk with me, and she just said, I need to pull you aside. I just want to share something with you and say thank you. And it turned out that her little guy had and this is why he was coming in, he had a problem with bedwetting. And he wet the bed every night. And it was such a problem, not only at home because, he's waking up, the bed's wet, but he wasn't able to go to sleepovers because he knew what would happen. He didn't want to wet the bed, with his friends around and things like that. He had stopped wetting the bed at home, and they thought that he was ready to attempt a sleepover. Aww. And his mom and the other mom, his best friend's mom, had talked. It was just him and his best friend because they didn't want other kids there in case there was an accident. And he made it through the night.
Yay!
He woke up with the dry bed. And for a little guy, I think about that and it puts a smile on my face. But afterwards, I was really reflecting on it. It's like, that's life-changing. I can't imagine that.
How old is he?
He's 11 years old.
Oh, he's 11. Okay, he's older.
I mean, can you imagine that you've had that many problems with...
Yeah, I thought you were talking about a little guy, but yeah, at 11, he should have that under control more, and that's he's getting into the age where people are kids are gonna be getting mean and making fun of him for it.
Well, and that's what the parents were really afraid of is being picked on, and they were also really concerned about him. That what is wrong with my child?
Yeah.
Why is he wetting the bed for all these years? And they had gone down a route where they were going to put him on medications. And we, at my office, had his sacrum was not sitting right at all, putting pressure on those nerves to the bladder and putting a lot of interference in there. We started adjusting him. He responded great, and his body was able to do what it's supposed to do. And now he's not wetting the bed.
Now, when we talk about this particular patient, I just want to ask, just out of my own curiosity, had he had an accident as a kid? I mean, he's still a kid, but as an infant or a toddler?
He had many accidents, and it was interesting in his initial consultation. He was involved in a car accident.
Aha.
And
truth comes out.
Yeah, and he was injured, and he was hospitalized, and it was hard because the mom didn't say that, after car accident it was
immediate.
It was immediate.
Yeah. Could have been years later.
Yeah. But she saw that as an incident that things weren't quite right after that.
Yeah. His little spine got shifted out of place in that impact, and definitely it got stuck, I guess.
Yeah.
So that's awesome that he's doing so much better.
Those things just float my boat, though. I love affecting people's lives in a positive way.
I agree. With that same bed wetting, kind of a tongue twister.
It is.
As we get older, sometimes that starts to come back and you get up a lot in the middle of the night because your bladder's not able to hold that amount while you sleep. And that's other end of the spectrum we were talking about right before we went to break. So just like adults can have that same problem, kids can have that problem too. And making sure that the nerves to the bladder works properly can sometimes be all that it was lacking. It wasn't lacking that medication to tighten those muscles of the bladder. It was lacking nerve flow.
Right. And what was interesting with him, too, is he also was having low back pain, an 11-year-old, low back pain. So
he was having a pain nerve and a bladder nerve pinched.
I mean, he had it all going together, but again, it was all in the same area. And the nerve was doing three things. It was making muscles work, nerves, what you feel with work, and organ systems work. So
makes sense to me.
Yep.
Well, a couple of other things that I see kids for in my office as well as adults is jaw problems. I actually have 3 different patients that are under the age of 10, and we're working on their jaws, their TMJ, clicking, popping, not able to open their mouths all the way because they had a fall or they had some other injury one of them was at gymnastics class, and their jaws started hurting. And at a young age like that, that's a long-standing problem that if they don't get corrected early on, something that could cause a lot of issues later in life.
Yep. Another one that's big in the office right now, carpal tunnel. Numbness, tingling, arms and hands.
For kids?
No, not for my kids. Not. I guess
well,
that's
we're talking about kids, and you're jumping around.
I guess my mind's a little wondering because I'm thinking about all the fun, things that were occurring in my office.
Yeah.
Not fun for the patients, but it's fun for me to treat them and and help people get better. But numbness, tingling in the hands. People coming in with carpal tunnel issues, things like that.
And a lot of them are misdiagnosed with carpal tunnel.
Yes.
And some of them even get the carpal tunnel surgery, and it does squat to fix the problem. But,
yep.
Another thing that we see very often that we've mentioned, we've actually done an entire show on headaches before, is headaches and migraines.
Yep.
And that leads me back around to talking about headaches in children. It's not a normal thing for kids to have headaches of any kind. Even if they're just sinus headaches, those are still not normal. So we always like to check out kids that are having headaches just because that's not a normal function that anybody should have, but especially a child. And I have a couple of my favorite patients that come in, and they're actually kids that we treat for headaches. And I've got a good clip of one of those children actually telling us about how we've helped her, and her mom will fill in a little bit where she left off. Let's hear
I like to go to Dr. Liz because she takes away my headache. I like to go to Dr. Liz because she'll take away my headache.
This one really fought migraines for about a year before we were advised to come to visit Dr. Liz, and she went from 2 or 3 migraines a week to no migraines for over a year. And then anytime she's been fall or we've needed an emergency adjustment, we've come in and her headaches have been gone almost immediately after an adjustment or 2. So monthly adjustments have kept her headache free and have turned her back into an energetic, fun-loving little kid. And we can't thank Dr. Liz enough.
And if you tune in to the recording of this later, I'll post it. When the mom mentions her being a fun-loving little kid again, she actually does a cute little dance. So I'll have to patch that into the video recording that we always post on our website after the show airs.
Well, and if there's people out there and they have kids and they want to bring their kids in so that they can achieve the same health goals and results, Dr. Liz, can you tell them how to come see either you or myself?
Yeah. If you want to check out an appointment with Dr. Jason, who's also awesome at seeing kids.
Oh, thank you.
Or myself. I'm pretty good, too. Call 615-727-3107, and that'll get you a consultation where we'll sit down one-on-one and we'll talk about what health concerns you may have, or maybe what goals you want to meet that you're not able to meet right now. We'll sit down and talk about that. We'll do an exam, and we'll take some special motion study x-rays. Normally that test is $250, but for the next 8 callers, we've only got 8 spots left for the week. Mention this, and we'll give you that same exam for only $20.
Yep.
That number again, 615-727-3107.
Yep, and if we're speaking to you out there, we'd love to meet you. We'd love a chance to show you what we do and how we can help you and how that there's a different future out there for you than what you're currently living right now.
You don't have to live in pain. You don't have to have headaches. And maybe some of your other symptoms that you're taking medications for, some other chronic symptoms that you have, they could be coming from a spinal problem. Now, we're not saying every symptom under the planet, under the sun, is coming from a spinal problem because there are other causes.
Sure.
But if those nerves are not functioning well, your body's not going to function well.
And your body has the ability to be healthy if you take care of it. And again, like Dr. Liz said, there's always exceptions to the rule. But in general, if you take good care of your body's going to give you a good life. If you treat it like garbage, it's going to give you results like garbage.
Well, that's a good metaphor.
Does that make sense?
Yeah, it makes sense to me.
Yeah.
If you're one of my patients, you may have already heard this many times, but if you're somebody who's not one of our patients, when I go over some health things and health tips that I have a workshop for in my office, one of the things that I always like to bring up is there was a medical research done, I think back in the 80s, a research pathologist, sorry, I was trying to forget what he was. A research pathologist actually did autopsies on bodies that they had the known cause of death, and he actually was able to trace back whatever that organ that failed that caused that person to pass away. He actually traced back to the spine. The most damaged to the nerve that went to that organ was also the most damaged nerve back at the spine as well. So he found a 97% correlation of damaged nerve at the nerve root as well as what the cause of death was. So there was a high correlation, a link that went together that supports what it is that we're talking about.
And I mean, if you dumb it down, your body gives you symptoms as warning signals that there's something going wrong. Symptoms were never around just to be covered up and then you pretend you're healthy. That's not health. Symptoms exist so that you can say, this is a problem, let's correct the underlying cause, and the symptom goes away because it doesn't need to be present anymore because you corrected what the body was trying to tell you.
Exactly. And a good analogy for that most people understand is your check engine light or your oil light.
Yep.
If those lights come on, the equivalent of fixing a symptom would be stick a piece of tape over that light and not look at that light anymore. But but not actually go check your oil, not actually go take your car in to have the check engine light checked. Why is that thing on? It might just be a gas cap that needs to be screwed on, but you never know until you get it checked.
Yep. Get it fixed and the light goes off.
And the light goes off. Same thing with symptoms going off.
So Dr. Liz, if someone's out there, they want their engine light to actually go off because they fixed the problem. Can you tell them one more time before we got to go?
Yeah, we're about to head out, but if you want to give us a call at 615-727-3107, we've got a couple spots left for the week. Give us a call for a consultation, exam, and those special motion study x-rays. As always, you're listening to A Guide to Healthy Living with Dr. Liz and Dr. Jason, and we'll see you next week. Turning off. Signing out.
Good show.
I
think we're getting.
I just dropped it.
I think we're getting our flow better.